Hi, I'm Dr. Jen Upton, family nurse practitioner with my doctorate in nursing practice. I currently have a regenerative medicine clinic where we focus on wellness and aesthetics. And here with me today is my dear friend Annie, who I've known since I was 15. Go ahead, Annie, tell us about yourself.
Yes, my name is Annie Walther, and I have been in business development for a little over 25 years. Yes, we have known each other over 30 years. And I am also a patient of Dr. Jennifer's because, like everyone else, I don't want to look twice my age, or what I feel would be twice my age. So I started coming to you for that.
So tell me, what was one of the barriers that you experienced when you thought about getting Botox?
So as I started to age and I noticed that stress was showing up on my face and in other areas of my life, and as I was reaching midlife, also headed into menopause, I started noticing wrinkles in places that I was not expecting them. I knew that I was gonna have maybe some crow's feet, of course my 11s, because I'm a judgy human, but I was not expecting, everybody is, but I was not expecting maybe lines around the sides of my face and some other areas that I just really felt were aging me. And I started looking into my options, but years before that, I had had a procedure where I had my 11s done, and it went horribly wrong. I had some paralyzation in my left eye. I ended up with a droopy eye. We had to watch it for 24 hours. I was very afraid. And so I had a lot of fear coming back in. And I'm so grateful that I know you and I was able to call you, and you had since developed this practice that you have now, and you were able to talk me through my options and what we could look for with that.
I love that. That's a really good insight, because that's what a lot of people are afraid of. Is I hear every day that they, at least the patients that come to me, they want to look like themselves. They want to look natural. They don't want to look fake. They don't want to look frozen. Yes. They don't want to feel heavy, and they want to look like themselves. That's the biggest thing.
I really did not want to look like my eyebrows were, up in my hairline. I didn't want to look like my face was frozen all the time. I wanted people to understand my facial expressions, and I wasn't exactly sure how that process would work. So you were so great at explaining to me, all the different areas that I could use to enhance things, but also just make me look like a better version of myself.
I love that. That's exactly what we are always trying to do. Just look like a better version of ourselves, so that people can see us, see our face, but still see you. I think that one of the things I've heard before is patients will tell me that they feel as they get older that they're not seen. People don't see them anymore, and the distractions, so they don't necessarily want to look 20 years old. I feel like most of my patients are okay looking their age. They just want to look like the best version of themselves in that age.
Yes, I have a daughter who is in her mid-20s, and I've never wanted to look the same age that she is. I just didn't want to look like maybe her grandmother's age. And so I wanted to try to figure out what that happy medium was.
How to find the balance.
How to find the balance between, midlife and crypt keeper. Where was that? Where did that land?
I think that's what we're always trying to do.
That's
right?
what we're all trying to do. That's what we're all trying to do.
I think that's why there's so much more to it than just Botox. And I know we've talked about this a lot before, and we'll talk about this on some of our other podcasts, hormone replacement, peptides, vitamins, healthy living, all of it, stress. We were just talking about needing to do an episode on boundaries, reducing stress, getting enough sleep. All of those things affect how we look on the outside. But when it comes specifically to Botox, I think that the key is less is more, allowing some breakthrough movement, allowing the patient to still look like themselves, but maybe just softening some of what we see and what ages over time. And I think that's a really big part of being a good injector, is understanding how the face ages and how it ages in that patient specifically, which muscles begin to get stronger and which muscles become weaker, versus just treating the same pattern every single time.
I appreciate that. I appreciate knowing that when I come in to see you, which is quarterly, that was what you laid out for me in my longevity plan of treatment. As I come in, we work on a different area every single time. We don't focus on the same area of my face every time, and I really appreciate that. When I first stepped in your office, even though I've known you for the majority of my life, is that you didn't just stop with, hey, how do you want to look better? You went into, what are your pain points? How do you feel? What do you want out of life? And that's when I learned that you have this whole other thing about longevity and wanting to live better and longer and all sorts of things. It's not just about how to make us, prettier, or, if you're a man looking more masculine or, younger or whatever that is, that there's another aspect to it. And I always thought that story was so amazing from you. the story of why you went into longevity medicine.
So I went into longevity medicine because I have a special needs daughter. And as many moms of special needs daughters feel like, one of the things that keeps us up at night is who's going to take care of my kid when I'm gone. And what do I need to do to live my best life right now, but also be as healthy as I possibly can, so that I live as long as I possibly can, so that I can make sure that someone takes care of that child. I feel like I can spot oftentimes a special needs mom, a mile away. So you can see that stress on their face.
Yes.
And the burden that they have. But there's so many, the more women I've gotten to know, there's so many more burdens and things that they carry on them that they always carry when they come in here. And so it is so much more. Most women who come into the shop, there are a few, they're the young women that are getting married in 2 weeks, and so then they just want to look a little bit better for their wedding. But I would say the majority of our patients are carrying a burden, and there's something that has made them not feel themselves anymore.
Yeah.
They feel that, and it shows on their face, and they don't want it to be there anymore.
Yeah, and I got that as soon as we started talking, even though, like I said, you've known me for the most of my life. You started asking me questions about how did I want to feel better? How did I feel about my weight? What was I eating? Every time I've been to see somebody about my skin and about what I've, been through, they didn't care about the inside. They only cared about the outside. And you started asking questions about what we were going through, how I felt about it, and what was needed there. And I feel that that's probably a ministry that you do have here.
Oh, it's definitely been a passion of mine for a long time.
Yes.
When I teach, there's a slide that we have in our regular didactic part that shows a woman at 35 and it shows a woman at 45. And it's a significant aging that happens between 35 and 45. And that really resonated with me the first time I saw it, when I was the participant, not actually the one teaching. It was one of the most depressing things I've ever seen.
Yes.
Like, oh God, we're slowly dying every day.
Yes.
But we don't want to feel that way. And I know that I've always heard, of course, Mom, I've always heard my mom say for years, I don't feel how old I look in the mirror. I'll walk by the mirror and I'll be like, oh wait, who's that? Because I don't feel that way anymore. I still feel the same way that I did when I was 18. But we stopped looking that way.
I think we've heard that from everybody. We've heard that from our moms. We've heard it from our aunts. And, I've definitely been heard it my whole life. My mom was a beauty queen growing up, and she definitely, stressed the importance of taking care of your skin and things like that. But as we've gotten older, I don't want to look, old and haggard and stressed out. And when I'm talking to people in my line of work, as I'm coaching high-end people, high net worth people, I don't want to sit there and look old across from them. I want to look, youthful and like I can, carry on a nice conversation. I don't want them examining all of my wrinkles and all of my spots. And so one of the things that I've really loved about that was just your gentle coaching there and giving me some grace. I learned about, metabolism and hormones and everything from you. And I went through a very harsh launch into menopause with you. You were there holding my hand the whole time. And I really appreciate your advice on hormone treatments and everything that you can also do here at Uplifting. I thought that was so great. That is something that you've added. And I just feel that ministry has been so valuable with you.
Preventative medicine was why I went back to school to do family practice. I wanted to get away from chronic illness, because ER is what I did for almost 20 years, as you know.
Yes.
But I started as a baby, it's 18.
Yes.
So that counts there. But chronic illness is hard, and it touches a lot of people. And acute care, right, is hard. And I did love doing that. But I think that we can offer even more if we can help patients not get to that stage to begin with, if we can help prevent that. And I think going back to that slide of a woman at 35 to 45, what's the major change that happens there? And it's perimenopause.
Here we are.
Yeah, it's where, and that is often what drives women to the chair. The first time they sit in the chair, they'll say, I feel like I aged overnight. I don't look like myself anymore. I looked in the mirror and I don't know who this person is. But they're also tired. They're fatigued. They have brain fog. And then like you said, because now women are expected to have full-time careers and still be fabulous moms, and we're taking care of our parents. So we have all of this burden on our shoulders. But we expect to look like movie stars.
Yes,
With our Instagram filters.
We have to have our Instagram filters and everything together all of the time, and still wake up and use a cream, and maybe we don't know where to get the cream, and now we have people on Instagram selling us the cream that may or may not work. What is the favorite new technique that you have in here that you're using?
We brought in a new device called Uplifting. I'm super excited about it. Uplifting works on the SMAS layer, which is the muscle that is holding things up. It's the same layer that they are working on when they're doing facelifts. So of course, nothing is going to be the same as a surgical facelift. But if you're looking for a non-surgical facelift, then we have to address all the areas where we age. So we age, and that's where it gets really complicated. There's so much out there, and it's hard to filter through it, like you were just saying.
Right.
So much out there on TikTok, and what is evidence-based and what is really just an influencer trying to sell something. And that is why I think that I always stay engaged in this space, because there's always something new to learn. And I think that's where my doctorate really helped me, is that a large focus of a doctorate in nursing practice is reading studies and learning what they actually mean and what are results that actually, if you can make a study almost show anything, but what is statistically significant. So I am excited about our new product, the Uplifting, because it is working on a different layer than we've been able to treat up to this point. So we have a lot of things that will work on, like we love our Morpheus 8, we love our Endolift, and they're going to work on the deep dermis. And then we have stuff that works on the epidermis with the microneedling and controlled damage. We have our lasers, our chemical peels. I'm a huge fan of biostimulants, which are going to help regenerate from the inside of the skin, making the skin tighter and bouncier. But the old therapy is going to work at the muscle layer, which helps lift everything up. So that's pretty exciting. And then we are pairing that with peptide stacks. So peptides are all the rage right now. Everybody knows peptides as insulin's actually a peptide. And then, of course, everyone knows their GLP-1s and their weight loss meds, which are peptides. There are a lot of other great peptides out there. And there's been a battle going on for the last 2.5 years with the FDA to get certain peptides approved and not shutting down your compounding pharmacies. And they are so effective and good at preventing disease that now there's a whole black market where a lot of people are buying them from these for studies only, and or not for animal use, and patients are buying them online, and there's no one monitoring that. So the FDA is, although there's a lot of pain points we've had with the FDA, you have to have somebody who is actually making sure that products are clean and that you are getting what they say that you're getting. And there's a lot of chemicals that are coming through some of these online products. So all of that to say that it's important that compounding pharmacies be allowed to make these products for us, because we want them, we need them, we're going to get them somewhere, but we want to make sure that what we're getting is clean and good. And so it's been about, I think, 2.5 weeks now since the FDA withdrew some of their their restrictions on compounding pharmacies being able to make them. So I'm super excited to be able to offer peptide stacks again now.
Why do you focus so much on teaching other medical professionals? Because that has always just been so amazing to me, that not only are you here and you're treating me and everybody else in my life and making us all look good, but then you take extra time to go and teach other medical professionals, other nurse practitioners, and those kind of people. How do you do that?
Well, I do it because, one, I feel like it makes us better when we collaborate together and when we can share those ideas. And two, because I think that it's important that a lot of the information gets out there about preventative medication, about hormones, about peptides, about the stuff that we didn't necessarily learn in traditional medicine and traditionally in school, but also doing it well and doing it right. So it's easy after you have a license to just hang a shingle and start offering something that you maybe don't know a lot about. And that can be dangerous as well as I think at least if you have a license, then there's going to be some looking into it. So it's not as dangerous as non-licensed people just hanging a shingle and offering things that they don't know about. But I think that collaborating together is huge, knowing the information and knowing how to monitor someone medically so that we can get the best out of these amazing tools that are out there is super important. And it's new and emerging information. So it's information that we didn't have before. So the things that I have, when I first got into the field, there were a lot of stuff that I had difficulty finding information on. So I've had a mentor for years. I love him. He's fabulous. And I learned a lot from him. But there were things when I went into this business that I didn't learn about, and I didn't have a mentor to call. And so hours upon hours of studying and looking into the evidence-based articles to find what was true and wasn't true. And I wanted to be able to share that because I can only touch the people in my community, but other providers are touching people all over their community, and we only learn when we share, and we do that together. But also, whenever I teach, I learn more about other areas as they come in and bring their expertise and ask their questions and things I didn't think about. And then, iron sharpens iron, and we get better. I
love that so much. I love that every time you come back from something, whether it's in Europe or over in, California and things like that, I think no matter where we are, we always feel that we're behind. And with you traveling globally, learning all of these tools and tricks and bringing them back to us, I've always appreciated so much the knowledge that you're gathering and the people that you're getting to know, and that you can use that to help all of us.
I do too. That's why I love teaching. That's when I first started getting into more peptides. I was teaching Botox, not peptides, but I had a lot of naturopathic doctors that were coming in and it was during COVID, and they were talking about the things that they were doing to treat long COVID and what worked and didn't work. And we'd always get off on those topics during lunch breaks and sometimes during the, the didactic, but try to keep it outside of the didactic. And then that drove me to learn more and seek more and get more information.
It's incredible. The wealth of knowledge that you have here and that your staff has here. When I have come in, whether I've been here for a facial or, my touch-ups or, having some laser treatments done, I've always felt like everyone is trying to have the largest amount of knowledge possible to help me with whatever I'm going through. And I've always really appreciated that. Why do you think that both of your locations are so successful?
We have a lot of great patients like you. And I have a lot of great staff. I think there's a lot of great people out there. There's a lot of great people that work for me. And I think that our patients too, people want to be better. They want to learn. It goes back to what we were saying again about women helping women. And that's what I see a lot. And I think there's a lot of really great women, and that's the women that come to me, and then they bring their sisters and they bring their friends when they feel better. And then the women that work for me also love that it's a little bit more of a mission than just a job. And I would say that whenever I meet with my staff one-on-one and I talk to them about what's important to them, feeling like they're part of something bigger, feeling like they're helping people is part of that. So I think that's it. I think it's not just me, it's all of us coming together and helping each other be a little bit better and bringing what they have to add to that.
I love that. Your team is so fabulous. When I came in, one of the first questions I did actually ask you, and I asked your team, is what do I need to know? So I was so appreciative of all of the advice that you gave me my first appointment here. What's something that you would encourage somebody the first time they walk in the door? What should they ask? What do they need to know?
Well, I would say the first thing is that just be honest and start with where you're at, what bothers you, how do you feel, and then a budget. I mean, really, that's true because we're all in different places, and I think that we're really good at helping people prioritize where to spend their resources and where they can get the best bang for their buck so that we can help them feel better with where they're at.
I love that so much. Yeah, you're a doctor and your lawyer, two people you got to be honest with. It's
but
true.
They say 70% of people lie to their doctor.
It's so true. It's nerve-wracking when you're walking in. You have this beautiful staff. You're gorgeous. Everyone on your team is stunning. And you walk in and maybe you're not feeling so great about yourself. And you don't want to say, hey, I feel like my smile is crooked, or maybe my lips aren't big enough, or maybe you're coming in and asking for something that isn't what you should be wanting. And I think that it's so encouraging when I walk in the door to have somebody say, oh, what do you really want? What do you really want out of this? The first time I walked in and I asked for one facial, and I got to talking to the girl that was helping me with my facial, and it ended up being that I had asked for the wrong facial. That wasn't what I wanted. And so she was able to redirect me. We were able to do something better and easier. Then I came back for the second treatment later, and it worked out so well for me. As I'm now talking my daughter through so many things, I've wanted to encourage her on what the best practice would be for somebody just starting out. Is it skincare? Is it nutrients? What do you think the best thing is?
I mean, it's kind of a broad question, but I would say if we were talking skin, then hands down sunblock. Of course, blue-eyed, blonde hair. Your daughter is a redhead, so sunblock, sunblock, sunblock. That's going to be the absolute most important thing she can do.
Okay.
And if we're talking about, of course, longevity and as moms, and we care about our kids, living the best life that they can and being healthy. When it comes to clean food, which that could be a whole other podcast. We want to talk about how hard it is to get clean food in today's world and what we're up against.
Yes, and I've always appreciated your advice to me on protein. You were out in front of the protein train that we're all now part of as women. The joke is, right, that we're being bullied far more about protein than we ever were about anything else in our lives, that we're being bullied to eat 100 plus, grams of protein a day. And you have had some great advice for me on how to get enough protein. Any other tips and tricks on protein and what to do?
Well, so I would say protein is, of course, important for all of us, but more important as we go into perimenopause and menopause. So for our younger children, our younger kids, our 20-year-olds, both our oldest kids are in their 20s, right?
We didn't say that.
Well, we were children when we had them, right?
Absolutely.
It was like 6, right?
Yes.
So I would say for our younger kids, it's more a variety of a diet, more trying to go to Mediterranean and stay away from these crazy trends and get as much fruits and vegetables as they can and get some grains and get a little bit of all of it and just try to eat at home and eat clean and organic as much as you can. And then when we go into that perimenopause and menopause phase where we're being bullied into protein because we need more protein and it's hard to get the protein that we need. I think it's almost impossible for most women to get the protein they need unless they can find some sort of a protein shake. And that can be tricky too, because now we've got all of these gut issues and some people, I struggle with dairy. So then finding a protein shake that doesn't completely upset our stomach when we're running all the time can be a challenge.
I have turned into one of those crazy old women that's standing there reading the labels. No matter what I'm purchasing, it drives me insane. No matter what I'm reading, I'm standing there looking at protein count and sugar count and carbs count and everything, trying to figure out what isn't going to upset my now stomach issues now that I've entered in midlife. And that's another part of that longevity that you talk about so much.
Have we talked about the Yuka app already?
No. What is this?
Okay, I love the Yuka app.
Okay.
YUKA.
Okay.
I don't get any money from them. I don't have any, whatever they call that. There's no reason I can't speak about them, but
okay.
I just love the Yuka app. My son is actually who brought the Yuka app to me the first time years ago because he's been into bodybuilding and helped push him in the direction of trying to be healthy and find out those things. So the Yuka app, you can scan it at the grocery store. Scan a barcode no matter where, any of the products that you're looking at, and it will give it a score. And I love this because the score is not only based on your fat and sugar content, but it's based on additives. And the additives are what are the endocrine disruptors, which are making us need hormones sooner and younger than we did before. It's what's giving us all this chronic inflammation. It's what's causing so many of our autoimmune disorders. There's so many things that are involved, and it's the additives that are in our food. And it is, anyway, I love this app. Scan it, it'll give it a score. Try to find something that's green in it. And what's amazing is that right at the bottom, it'll give you 4 or 5 other options that'll be right next to it in the grocery store that have a better score.
Okay, so checking for additives, one more thing to look at. As we've sat here and we've pitched things back for 30 plus years, I've always really loved, that we've sat here and we've talked about hair growth and skin and nails and all of that kind of stuff. When I come in, because I'm about to come back in the door for my touch-up, what are they gonna talk to me about? Because I'm dead set. I'm rounding the corner on 50. What is coming my way?
Well, I mean, we've already touched on hormones, and then there's anti-aging peptides. We're going to have that conversation.
Rounding the corner.
And then, of course, mentioning hair and nails. That is a big issue as women get, maybe 50s, closer to 60s, hair loss.
Yes.
Hair loss is an issue that women are dealing with, even when doing hormone replacement therapy. Lots of different components and reasons come into that. But some keys that we can really dive into is, of course, stabilizing hormones. Our thyroid starts under functioning as we get older. We don't get enough iron. Vitamin D is a real key one too. Most of the American population is low on vitamin D, and vitamin D is huge for hair growth and supporting our thyroid.
Okay, so I heard a thing the other day, and again, this is that whole do we trust the TikTok wisdom or do we not? I heard a thing that was that vitamin D is vital for people on a GLP-1. Is that true?
Well, vitamin D is vital for anybody. We all need vitamin D. It's a fat-soluble vitamin. Many argue that vitamin D should actually be considered a hormone, not just a vitamin. Part of the issue with vitamin D is that it's not going to absorb unless you have enough vitamin K. And then we all think, because we live in South Texas and there's way too much sun here, and we're all trying to protect ourselves from the sun, that we should have an exorbitant amount of vitamin D, but most of us are low in vitamin D. And that comes from a lot of the over-the-counter medications blocking absorption, gut absorption, all of the, again, endocrine disruptors in our food. So I would say a good vitamin D supplement, 2,000 to 5,000 milliequivalents a day, and a vitamin D that has K in it.
Okay, all right. So it has enemies and it has friends, and we have to know what's what.
That's right.
Okay, all right. See, learn something new every single time. So I just wanted to say that, as we've sat here and we've chatted about midlife and all of the things like that, what are you seeing the most of from women walking in the door? Because, I've got aunts, I've got all sorts of relatives that I'm, always recommending to you. You've got, you treat your family members as well. What is the next step going to be as we start to age again? As we hit the next level, as we level up?
Yeah, I would say biostimulants. Mm-hmm. So there's been a big move away. So I think internationally, America has been the laughing stock for too much fake filler, too many fake boobs, not looking right, not having that natural look. And I think that we're seeing that move away from that, even in the United States, which I'm super excited about. I rarely now have people asking me to add more and more lip filler, which that used to be a thing in the beginning, is I had to say no almost every day to no, there's no more room for lip filler in your lips. Dear. So I think that, but to your point, what is the next thing that we're going to be looking for is biostimulants. Injectable biostimulants like your Sculptra and your Radiesse. I love them both. They're both really great products. Sculptra works with inflammation, and our GLP-1s are an anti-inflammatory, because too much inflammation, right, is not a good thing, and that's what we see in excess of right now, trying to bring down the inflammation. Radiesse works more mechanically, and it's not relying on the inflammatory marker, so that tends to be the one that I'm going to grab most often these days. But I also have a majority of my patients on at least a microdose of GLP-1.
I love it. I love it. And that's something that we've talked about before, is your amazing weight loss program that you have, that you offer to people. So, when I come in, if I want to get started on that weight loss program, because it is a battle going through midlife of being on that weight loss program, what are we going to talk about? So labs. I think labs, and I think there should be medical supervision because we just talked about protein, right? Mm-hmm. And why is protein so important? Because we need to maintain our muscle mass. And our muscle is one of the things that's going to help make our hormones. It's what we need to support our bone structure and to prevent osteoporosis. And having enough muscle mass, we have to have enough protein to make it. And when we lose weight too fast, we lose muscle. And that's huge. And then we also lose hair. We block absorption of vitamins. So the first thing we're going to do is look at your labs. I think that's important. And look at all the things we just talked about. We'll look at a ferritin level, a vitamin D, a vitamin B12, a systemic inflammatory marker. Look at your hormones, all the things, so that we kind of have an idea of where you're at. And people that are on our weight loss program, I do tend to focus more on microdosing. There is a place, of course, for higher dosing. And especially for our diabetics. I've worked with diabetics for years, obviously, in the not only chronic care, but even in acute care and in primary care. GLP-1s have been around for over 20 years. They're an excellent drug. But now it's being used for weight loss and for other things. So I think, though,
making sure that the dose doesn't get too high so you don't suppress your own production is really important. And then making sure that you have your gut health, because GLP-1s are made in our gut.
Right.
And so that's all part of the weight loss program, is making sure you have good gut health. And it's not going to work if you, or it's going to stop working if you don't change what you're eating and change your lifestyle habits. So and there are people doing this, taking GLP-1s and just drinking Diet Coke and eating donuts, right? Lose how much they're eating, right? They can have a longer problem, a worse problem in the future. So I think looking at the whole picture for all of us, for everything.
For everything. And there we are, right back to that longevity medicine.
Yeah.
I love that so much.
They come in for Botox and then we talk about longevity.
That is my favorite part of being here, is I come in for, one thing, just, fixing a wrinkle here and a wrinkle there, and we end up talking about what it's going to look like for the next 10 to 15 years. I've also loved that you are totally willing to work with men. You've helped teenagers with acne so much, and, and I've loved all the advice on that. Who's your favorite, type of client to work with?
Right. I love all the clients, but I go back to my mission and focus often comes back to the middle-aged woman who has the burden of their children and their parents and their career and their family, and often they don't take care of themselves.
Yeah.
That's why I think another podcast you and I should have on boundaries would be really great for our patients too.
I think that there's so much that you do cover that is outside of the realm of just medicine and fixing the face. When I come in to see you, it is so much more about learning about the whole person and what they need to, help every aspect of their life, not just, I'm going to make your face prettier. It helps all of us so much. And I've really, really loved that about being here at Uplifting.
Well, you do a lot of that too. That's what you do in all of your consulting, just on the other side of things, your personality testing.
Yes.
I think that's been huge in helping people find to work within their strengths versus trying to work within their weaknesses.
It is, and that's one of the reasons that I, have loved this combo so much, is as I'm working with other people and trying to help them, yes, I start out working with them and helping them figure out their personalities and what they have going on and what their business conflicts could be, but then everything is connected, right? You know that, and I know that. And so as I'm working with them on that, typically we also end up talking about their health and where that all comes back to. And so I feel that every aspect of what we do is so connected together, that whether it's your business life or your personal life or, medical, personal, professional, it's all going to circle back around together. And so as I'm helping people learn their best business type, their best business direction to go in, inevitably part of that is if you're unhealthy, it's not going to matter. If you're not around, it's not going to matter. So you got to take care of yourself. And so I've really appreciated the knowledge that you've given me over the years.
Well, and that brings us back to why I got into the business in the beginning, so I could live as long as I possibly could.
And you have just set such a beautiful example in front of all of us. As I've watched you over the years, and as you've come in and out of the room to help treat me, just watching you, even yourself, work on yourself, work on your diet, work on how things are. And with the whole family, your sisters are here with you. I get to come in every now and then and dabble in the business. You've got friends here with you. And I've really appreciated that whole life aspect of Uplifting. That it's everybody. It's a big family. It's not just very clinical, walk in the door, and then you walk back out.
But it's work, as you know, because you've helped us work on a lot of that stuff in the background. Having a positive outlook is work. Being healthy is work. Making healthy food choices is work. It's a conscious effort that we have to decide what direction we're going to go and get there.
It is. And I know that one of the most important things that we can do in life is have the people around us supporting us that know the area that you don't necessarily know the best in. So I defer to you with my medical health and my physical health, and I'm so grateful that you've allowed me to help you with some of your business health as well, and as we've worked through that. Okay, so women, midlife, we're struggling, we're going through, we're learning how to circle through all of that. As I'm just sitting here thinking about everything that we've just talked about in the last few minutes, I just have one question. What is your secret to just looking so glowy?
All the things.
All of it.
All the things. If I offer it here, then I've probably dabbled in it.
Yes.
If I don't think it works, then I'm kicking it out the door and we're not offering it anymore.
And I love that you have you've switched out your products over the years. that you've learned something new and you've changed.
Yeah. Well, and I am the best patient to try things on because I have overreactive skin, super sensitive skin. I react to things in unusual ways. Actually, so do our other nurse practitioners. So we all kind of like to experiment with ourselves first and see how we're going to respond.
It's a great guinea pig. I love that so much.
And having walked through it, walking through perimenopause, I think that's a game changer too. When you go to talk to someone about hormones, if you've experienced it, you know exactly when they're sitting across from me saying that this is what they're experiencing. I'm like, oh yeah, I know. I was feeling that yesterday.
That's right. That's right. We love it when, we all have a good, hot flash story that we can share, and, the different aspects of finding things going north and south in different directions that we were not planning on.
Right?
Yes, I've loved each and every lifting moment. And when you told me that you were going to name your studio Uplifting Medicine, I thought that was so perfect because that's what we all need.
Right? Well, I think one of the a good place to end is that, well, I hear this from my patients all the time, which aging is not for the faint of heart.
No, it is not.
It's a tough business.
It is a tough business, and you help us so well with it. We've shared memes back and forth. We're old friends. That's what we do. But my favorite with all of this is I keep repeating the horrible, awful Bill Pullman speech from the Aliens movie where he's saying, "We will not go quietly into the night. We will keep up the good fight." That's my favorite that I always remember when I'm, trying to make my decisions about coming in the door, and what I'm going to ask about is, what is it that I still want to fight? And you've always been so great and so helpful with that.
All right, thank you, Annie, so much for being on our very first podcast.
Thank you for having me.
Of course, my old friend. I had to call someone who would be easy to talk to. It was really great. Thank you guys for tuning in. If you have someone who might be struggling with menopause or any of the things that we've talked about that you think this will help them, then share. And we look forward to seeing you on our next podcast.